Broadcast is now starting. All attendees are in listen-only mode.
Good morning and welcome to the Department of Family and Support Services Adult Protective Service RFP. Just a little housekeeping before we get started. My name is Julia Talbot. I work in procurement here at DFSS, and today I will be joined by Karen Kolb and Tasha Smith, who will work in the Senior Services Division of DFSS, and they will be talking about the scope of this RFP. Due to really, at this point, DFSS protocol, everybody's on mute, and we would like you to submit any questions that you might have into the question box, and we will respond to the questions after going through the slides. And please use the question box to notify us of any technical issues. Now I'm going to turn this over to Karen, and let's take it away. Thank you, Karen.
Thanks, Julia. Good afternoon, everyone. Thank you so much for joining us today to learn more about the Adult Protective Services RFP, which was released last week. I appreciate all of you being here. I know we may have some additional folks joining us as time goes on. As Julia said, we welcome your questions, and if you could kindly put them in the chat, then we will be able to see them as we go along. However, please know that if there are some questions that will be answered later in the presentation, we'll go ahead and carry on with the presentation, and then we'll get to your questions as we go. So if everyone has their screens on and can see, you'll see the copy of the Adult Protective Services RFP that went out last week. That was a PDF, and it went to a broad base of providers throughout the Chicago area. And please don't hesitate to forward it to your colleagues. You should have received a PDF for this, and we're doing the application a little bit different this time. Spoiler alert. So we'll be going into that as we go ahead. So these are all the things on our agenda today. And if you'd like to go ahead and move on to the next slide, Julia. Great, thank you. So again, this RFP comes up every 3 years, and we're seeking proposals from, of course, aging professionals, social service agencies, and aging service providers who have experience providing case management services to those who are older adults and those 18 to 59 with disabilities. And in particular, of course, the Adult Protective Services is essential for conducting the investigations into maltreatment and helping to support those who are actively being abused or those who are at risk of abuse. And really the goal of the Adult Protective Services program, which you may hear me call APS, is to support older adults and adults with disabilities who are experiencing abuse, neglect, or of course who are self-neglecting, or who are a victim of financial exploitation. So this RFP is actually a little bit different than our RFPs because the provider agencies who are selected through this RFP process, we review the RFPs and we make a recommendation to IDOA about who we think should be funded based on IDOA's stipulations and requirements. And so we recommend those who score the highest, and of course IDOA makes all the final decisions, and they contract directly with the selected provider agencies. Next slide, please. So, of course, senior services is one of 7 program areas within DFSS, Department of Family and Support Services. Department of Family and Support Services is a lifespan department. We have youth services, children's services, domestic violence. We have our community service centers and workforce. Youth services, which you know, of course, for our One Job Chicago program, and summer programs for youth. And we really serve people from when they're very young until they're very old. And senior services is the division where we focus on individuals who are 55 and better, who are grandparents, and older Chicagoans age 60 and better. So we're what's called the Area Agency on Aging. And we're one of about 7 cities that have the Area Agency on Aging actually rooted in city services. So you can think of our peer cities like Seattle, Los Angeles, San Francisco, New York City, Atlanta, and so on. So we really try to focus and fund services for all older adults, but of course we prioritize those with the greatest economic need, those who live alone, and particularly those at risk of institutionalization. And as I'm sure you can imagine, for our adult protective services, they frequently tick all boxes. We really work together with our delegate agencies, our aging network partners, and try to support people to live independently in their own communities and homes for as long as possible, and really the setting of their choice, whatever that may be. Ensure that those who reside in institutions are treated with dignity and care, and that, of course, is predominantly our ombudsman program. And then also guarantee that older adults have access to accurate information and can participate in the public policy domain. So together with our service providers, we provide information and assistance, meals, both home delivered meals and congregate meals. We have our 6 regional senior centers and our 15 satellite senior centers. We offer fitness classes, evidence-based programming, caregiver support, legal supports, employment and volunteer training, all of the things that you see listed there. We try to continually innovate and advocate to support older Chicagoans as they age, and really to also promote social engagement as an antidote to dependent social isolation withdrawal. If you'd like to see some information about DFSS, please check on the link that was below. Next slide. Thank you, Julia. APS is a social services program that supports older adults. APS programs investigate reports of maltreatment, provide support, and in some cases, case management, and connect with those facing abuse to a variety of protective, emergency, and support services. As you know from the state program, IDOA hosts the statewide adult protective services, and it's modeled on the principles that you see below. Advocacy intervention by APS provider agencies, and of course, and this is a tricky one sometimes, the right to self-determination by the alleged victim. They decide where and how they should live. They choose to accept social services or other community assistance or not. And then they also can make decisions that are different from those of a reasonable adult that are not harmful to others. And of course, there are guidelines that you must adhere to as a provider agency, and you can see those on the link below. Next slide. And all of these links are found in the RFP attachment that went out with the invitation. So really, the goals of this RFP and of this program is to support older adults and adults with disabilities who are experiencing abuse, neglect, self-neglect, or financial exploitation. And as we've discussed, the APS provider agencies investigate reports of maltreatment, provide support, and in some cases, case management, and connect to those facing abuse to a variety of protective, emergency, and support services. Next slide. The target population for this program is adults over age 60 and adults age 19 to 59 with disabilities who are experiencing abuse, neglect, self-neglect, or financial exploitation. So up to 5 provider agencies will be selected to provide adult protective services for the 10 zip code regions of the city of Chicago. You'll see them listed in this table out by number, and the next slide details how they are by the map. Here you go. You can see the 10 different areas of the city. Next slide, please. So all program requirements are stipulated by IDOA, as this is an IDOA funded program and your contracts are with IDOA. So really there's a link in the RFP that takes you directly to all of the guidelines for this program. But to reiterate on a high level, there are various areas that you have to do, program requirements. There are staffing individuals, so you can see here you need to have a nurse, a social worker, dietitian, and or a pharmacist. And you have to have ongoing case activity and operations, so that includes intake, assessment, next slide please, Julia, casework, follow-up casework. So those are all the components of the actual activities that are done. Next slide, please, Julia. And then there are different components of the program that also have to be encapsulated into your delivery of services. That includes early intervention services, which is funding to help to mitigate some of the challenges that older adults at risk may face. Having a multidisciplinary team, and that is a team that provides guidance on challenging cases, who will meet 8 times a year and provide guidance specifically to the provider agency. And then, of course, the fatality review teams, and they work around areas of suspicious deaths. Next slide, please. Also, as required by your agreement with IDOA, you will be required to do public awareness and education, of course, to do outreach to entities that may refer folks, or just to help spread the word about the Adult Protective Services program in the community. And also, all of your staff and team members who work with the Adult Protective Services program will be required to do APS training. And we, as the City of Chicago, are what is called the RAA, the Regional Administrative Agency, and we oversee the different providers within the City of Chicago. So the Illinois Department on Aging provides funding for the APS programs through general revenue through the state of Illinois on a fee-for-service schedule, and that the fees are payment by case, unless if you see the early intervention, of course, varies. In addition to that, we, as the regional authorizing agency, support our adult protective services agencies with funding related to support things like their M teams, the fatality review, and so on. Now, staffing, again, this is something that there are particularly stringent guidelines within the city requirements. So you can see that you must employ the following health professionals who have the specifications listed in this list, and those range from how many hours a week they must work, that you have backup plans in place, that you have a wellness program schedule, and so on and so forth. Next slide, please. All APS supervisors must have a master's degree in one of the listed disciplines. They need to be registered in one of the areas below, or have 3 years worth of experience in human services and supervisory experience. They have to have adult protective services certification and online training. They have to complete the level 2 training and complete the supervisor's training. I've been through them. They are interesting, intensive, and doable. So please don't be put off by the number of training that they are. It's crucial for the level of work that APS workers do. Then also workers need to do in-services of 14 hours and the other qualifications that you see here, 11 hours of qualifying recertification in 3 years. Okay, next slide, thank you. Then all of the caseworkers working in APS cases need to have the following criteria listed in A through I here. And you can see it's a master's degree, licenses for RNs, and so forth. Next slide, please, Julia. And again, for additional information and guidance, we encourage you to look at the Illinois Administrative Code 270. And this is the exact section that pertains to adult protective services again, this is in the RFP release that went out. Some other things you'll need to consider are background checks. So you'll have to comply with all applicable background checks, fingerprinting, and screening procedures. And you'll need to do that whether it's staff involved with it or if it's a volunteer, consultant, subcontractors, and so on. Anyone that is interacting with the APS clients will need to have their background checks done. Next slide. And at DFSS, we are particularly stringent with these things. This is a very vulnerable population, and we all appreciate the degree of certainty that we have to have for staff who work with these individuals. So you can see that includes a fingerprint criminal background check that it checks for FBI and state databases, a search of the Illinois Sex Offender Registry, looking through the Adult Protective Services Registry, and then if there are children who you will be seeing, you will need to look within the CANT system, which is Child Abuse and Neglect Tracking System. So in addition to having records of completed checks during monitoring visits, delegate agencies also need to have written policies on background checks. And you can see those listed below. That includes everything from an appeals process to a list of offenses that disqualify a candidate from being hired or volunteering. So please do pay particular attention to that, because failure to provide evidence of your background check completion may result in default and possible termination of your agreement with DFSS. Next slide. Okay, COVID and other emergency contingency planning. Well, I think we all learned in the last few years that having emergency plans and continuity of operations plans is essential, because we know we need to see our most vulnerable. So we do ask that each of the respondents have a special emphasis on making those contingency plans, and that they should follow the guidance of the CDC, IDPH, and FEMA. And you will need to have an emergency service plan for continuity of service or maintenance of service, and then also to support clients' well-being during periods of weather-related situations. So tomorrow, for example, our heat index is set to be 101 degrees. So we've had heat issues, we continue to have cold issues, and certainly there's other relevant issues we need to continue to provide services throughout. So in addition to the reporting requirements that IDOA requires the provider agencies adhere to, DFSS also requires that the selected provider agencies report on the metrics that you see on these 3 bullet points on a monthly basis. The number of cases broken out by the individuals who are being served, the number of self-neglect cases, again, broken out by population, and then any and all outreach activities undertaken. So most of the information for the Adult Protective Services program is collected via the case management portal or the CMP via IDOA. That is online. And so that will be your traditional case reporting. Next slide. This is a repeat slide. Thank you. So the term of contract is going to be these services for this contract will start on October 1st, 2022 and run to June 30th, 2023. So the traditional year of this is July to June. So we're starting a little bit late this quarter, this year. And then we will offer the Illinois Department on Aging will offer 2 one-year renewals if the delegate agencies or provider agencies are in good standing. Next slide. So we would like you to submit your application. Awards will be made by regions. We encourage you to apply to 1 or more regions. Those who intend to respond to more than 1 region only need to submit 1 application. But on that application, you will need to clearly denote the regions from which you are applying. and the evaluation score received for one application that one application will be applied to each of the applicable regions for which the applicant is applying. So if there is one applicant who applies for regions 1, 2, and 3, and another applicant who applies for regions 2, 3, and 4, whichever of those individuals has the highest score for 2 and 3 will be selected for those. So again, see the list in the target population. Up to 5 provider agencies will be selected. You could apply for all 10 Chicago areas. And then you will provide services on behalf of IDOA. Next slide. So eligible respondents, we encourage a wide variety of applicants. Private, public, nonprofit, or proprietary organizations are all eligible. You will need to have pre-qualification requirements, including but not limited to a DUNS number and SAMS number. Applicable fiscal management and financial stability. You need to be in good standing with Secretary of State and are not on any debarred, suspended, stop payment, or excluded parties list. How are things evaluated? Each eligible proposal will be evaluated on the strengths of the proposal and the responsiveness to the selection criteria. We, of course, reserve the right to consult with other city departments during the evaluation process. And successful respondents must be ready to proceed with the proposed program within a reasonable period of time upon contracting. And again, that start date is October 1st. Failure to complete a proposal or insufficient responses or incomplete responses or requirements will cause the proposal to be deemed unresponsive and therefore subject to rejection. This is a different map. I'm not sure. Okay, here we go. So selection criteria and basis of award. So the selection criteria, there are 100 potential points, 30 points for experience, 24 points for qualifications, compliance, policies, and capacity. There are 13 for collaborations, investigation, and service experience, and 33 for financial preparedness, diversity, and public information. DFSS may consider factors in the selection to ensure systems level needs are met. Geographic service array, language, and ability to serve specific subpopulations as seen above. We'll recommend the respondents with the highest scores, and IDOA will make the final decisions and contract directly with the selected provider agencies. We reserve the right to seek clarification of information submitted in response as stated earlier, and or make site visits or require respondents to make oral presentation or be interviewed if necessary. Again, failure to submit a complete proposal or fully submit to all requirements will cause the proposal to be deemed unresponsive and therefore subject to rejection. Next slide. So we're here today, pre-proposal webinar, July 18th. Your due date to submit the pre-proposal questions is on Friday, and applications are due July 28th. And the program period begins October 1st. So this is a quick timeline. I know you all have been ready for this. And so we're ready to get going. Next slide. Again, applications are due on July 28th, 2022 at 12. Julie, is this your slide?
So thank you so much, Karen. So I usually just go in, usually at this point, I start talking to people about the fantastic and totally awesome e-procurement system. But as Karen discussed earlier in the webinar, because this is going to result in an IDOA contract, we're not going through the city procurement. So you actually just are going to submit a paper PDF, a file copy to us, not via e-procurement. I would just say here, use the RFP document that you have been sent. Pay specific and close attention to the program descriptions and requirements section. Remember that the selection criteria aligns with the scope or the program requirements, and that we use all of these things. Our questions, our scopes, and our evaluation tools are all aligned with each other. So if you have a question or you're wondering like what direction you might go in or what you might emphasize in any given answer, you should really look at the RFP document, look at that scope, look at the selection criteria, and use those as your guideposts. I think this should be, this is an interesting opportunity to do some really important work for the senior and older Americans of Chicago. And so we're really excited to have so many people here today, willing to listen and hear about us. I apologize for those 2 slides that didn't belong there. They snuck in for a webinar that I'm giving tomorrow. Other than that, I always tell people to start early and to save often. Computers are perhaps I'm dating myself, computers are a lot more reliable than they used to be, but I can't even tell you how many things that over a lifetime of saving documents have been sucked away or missaved. At this point, we're going to cut this opportunity. We are going to open this up for questions. And then I can take out the extra slides and PDF this over to Karen, and she can send it out to the list of everybody who attended. If you want to keep this PowerPoint, you can enjoy it over and over again. We also will get a link to the DFSS YouTube channel where this will be posted. And so if you have other questions or you just want to review this or pass it on to colleagues who might have missed this opportunity, this is we can make those things available to you. So as of now, I'd like to open the floor for questions. If there are any questions about the program or anything, this is really your time to ask. Karen, is there anything you'd like to add?
No, I think I may have done a screenshot on a slide, a couple slides down, of what the application looks like.
Oh yeah, here we go. How to submit. I thought that this was the wrong slide, because this is usually where I have some things and I'm like, oh, how to submit an application. Oh no, I didn't take something out. So no, here it is. This is the application that you'll be looking at. Very different than if you filled out anything on e-procurement. Very different, perhaps friendlier than what you might be used to. So you've been sent, I believe, a complete fillable PDF as part of the application packet. The applications are due via email to this address, seniors_RFP@cityofchicago.org by 12 p.m. noon on the 28th, I believe, is the due date, not the 21st. And all applications should have that subject line. So I'll make this correction when I send this out. But remember, it's the 21st, or the 28th, rather. The 21st is my friend.
What are the questions?
So,
sorry.
What are the questions? Also down here, this is just like, I think, the first page, correct?
Yes, that's the first page.
So this is you, as we talked about, you're going to check what proposed service areas you want to go to. You're going to tell us who you are. And then just when it gets interesting, we I think, cut it off. So you'll have to just open the application document to find out what incredibly weird questions we're asking. So again, if you have a question now, really anything. I did not know it was going to be quite so hot tomorrow.
Very hot tomorrow.
Yeah.
101.
Pardon?
101.
Pardon.
Oops, Keisha's got her hand up, I see.
So please put your questions into the question box. I see somebody. Yeah, I don't see anybody. Oh yeah, this is Keisha Brooks. Yes, if you could just type your question into the question box, that would be brilliant, Ms. Brooks. Yeah. So I don't know. Are you excited about this particular program? Like, how do you feel that this? Do you have anything you'd like to discuss about the APS program? Oh yes, Keisha, Ms. Brooks. This is yes. We will send you a copy of the PowerPoint.
Certainly.
Yeah.
Thanks for asking, Julia. Really, this is such an important program, and it really and truly serves Chicago's most vulnerable and at risk. We get a lot of folks sent to this program because of our CAS and ICAS programs, which are our case management programs and our early identification of people living at risk. And so it's just such a crucial program. And so we really stress the importance and honor the work that our existing provider agencies do and encourage everyone to apply for this.
Yeah. Do you, just out of curiosity, do you know offhand, and this isn't exactly a fair question, but do you know offhand what the caseload is for the year, or like how many APS cases there get started every year or every month? Or?
That is an excellent question for our program manager, Tasha, who is on the phone. Tasha, can you answer that question? You could put it in the chat, or you could also put it into the
questions or into the chat. Or I see you've unmuted, so perhaps you can just tell us.
Okay, the question, how many, ask the question again, how many?
So I was curious as to kind of what is the caseload burden or the caseload of this program? Like how many cases generally get started either like a year or a month? Like I don't know what the right duration is.
Like for the year, it can be at least 1,000 for the year.
Okay. So you're so anybody who's applying for this should be expecting, anywhere between 50 and 100 calls or cases being started every month.
Yes.
Are there any peak times?
Let me, if you'll give me a moment, and I can look through my files, and I'll see any peak times.
Yeah, because I don't, I would be just my own curiosity getting the best of me always is like, do people's relationship with their elderly or disabled family member go south over the holidays, or is it more of a summer thing?
Well, it's an interesting question, Julia, and we'll see what Tasha's data shows. But usually and historically in aging services, around holidays, when people go see their family, or maybe they see their parents or loved ones for, a birthday, which of course happens all year. But when folks come back and see them after they haven't seen them in a while, sometimes that's when the referrals may occur frequently. So we usually see an uptick in aging services in general over the holidays and around the first of the year. And then additionally, I would say that, certainly we get concerns from banks, healthcare providers, social service providers year round, because of course they are mandated reporters. And there are many activities that if you see someone who is being abused, that you do have to report. So those, of course, have to be. Great question. I'd love to hear any comments. And Keisha, I did send you the copy of the release, which went out last week. And if anyone else has not received that on the call, please don't hesitate to put your name in the chat. I'll go ahead and send it right now. And Keisha, if you want to just confirm receipt, that would be great.
Yeah, and I've also noted your email address so that we make sure that the PowerPoint and stuff goes out as well. We also have, we do have, as part of registering for this webinar, you did give us your email address, so we can use the email addresses that were reported that you used to sign up for the register for the webinar today as part of the to send stuff out. So yeah, I think I'm trying to think if I have any more questions, or is there anything that you'd like to kind of emphasize or
Yeah, thanks for asking, Julia. I would say overall, this is a fairly cursory application. It is not particularly difficult. It is not particularly, I mean, I never want to say something's not time consuming. There are some questions where you will have to submit additional paperwork. But in general, it should be a fairly straightforward application. And I, as always, recommend that people showcase the type of connections that they have within the community and the relationships that you all have that help to really create an excellent program. And please don't hesitate. Sorry, go ahead, Julie.
Oh no, I was going to say if there are no further questions at this point. Oh, Tasha, are you back?
Seems, yeah, seems like more so from what I'm seeing, like late spring, summer.
Oh.
That's what I'm seeing. Yeah.
Thank you, Tasha.
If there are no further questions, I'm going to just close out the webinar and we're going to get ready to send out, all of the materials. And when I get the YouTube link, I'll give that to Karen and she will send it out to everybody who has attended today or out to the general vendor list. If you have further programmatic questions, you should, of course, call Karen. If you have non-programmatic questions about, sort of like, how do I submit or how do I, I don't know what a non-programmatic question would really be in this case, since we're not doing it for e-procurement. But if you have, a non-programmatic question, you're more than happy to talk to me, or I'm more than happy to talk to you about it. If you do ask me a programmatic question, I will be referring you to Karen because you don't want me telling you about senior program. I could tell you about senior program, but I wouldn't know anything, so it would not be in your best interest. That being said, I hope that you enjoy the beautiful weather today and stay out of the heat tomorrow. And thank you all so much for coming. Is there anything closing words, either Tasha or Karen?
Thank you and good luck.
Same. Thank you. Thank you. Good luck as well.